Hello, welcome, and thank you everyone for joining us today. I'm Andrew Barrett, Program Officer with the Healthy Food, Healthy Lives Initiative here at the New York Health Foundation. Our overarching goal for the initiative is to connect New Yorkers with the food they need to thrive. And we currently focus on four strategies: supporting equitable food systems planning and capacity building around the state, maximizing nutrition benefit programs, supporting healthier, culturally responsive purchasing in public institutions, and promoting food as medicine interventions. Before we get started, just a few housekeeping items. We will be recording this webinar, and a recap with a link to the recording and any other materials will be circulated afterwards. Video and audio are disabled for attendees, but we do invite you to use the chat box throughout the event to share any questions. After the presentation and discussion, we'll respond to as many questions as we can. Finally, we have a closed captioning feature available, which you should be able to select at the bottom of your screen. So with that, let's get started. Thank you again for joining us today to discuss food access and policy in New York State. Last week, the New York Health Foundation released a data brief examining household trends in food insufficiency in the state from May 2020 through October 2024. Since the onset of the pandemic, the U.S. Census Household Pulse Survey tracked the social and economic impact of emergent issues on U.S. households and reported the findings on a near real-time basis. It was conducted bi-weekly, and the survey included questions related to physical and mental health and food insufficiency, which is defined as a household sometimes or often not having enough to eat in the previous 7 days. Today, we'll use the data brief as a jumping off point for discussion. Our speakers will provide top-line takeaways, dig into some of the policies and on-the-ground realities of food access across the state, and highlight challenges and opportunities to address them, and especially in the current federal context. I'm pleased to welcome our panelists today, and we're honored to have them join us. Camille Okonkwo is a Policy and Research Associate here at the New York Health Foundation. Joel Berg is the CEO of Hunger Free America, and Kim Mascaratolo is the Director of Communications and Advocacy at Hunger Free America. I'll turn it over to Camille to introduce herself and share more about the brief, which will be followed by a Q&A with our panelists.
Thank you so much for the introduction, Andrew. And my name is Camille. I'm a Policy and Research Associate at the New York Health Foundation. And today I'll be sharing some key findings from our recent analysis on food insufficiency in New York State. Andrew provided a great overview, so I'll briefly touch on a few important points. New York Health Foundation focuses on food access because there's a strong evidence linking food hunger and to adverse health outcomes. For example, in our 2022 Food and Health Survey, we found that food insecure New Yorkers were twice as likely to report poor health outcomes compared to those who were food secure. And you may be more familiar with the term food insecurity, but food insufficiency is a more severe short-term indicator. It's defined as households sometimes or not often having enough food to eat in the past week. And as Andrew mentioned, New York Health Foundation has been tracking food insufficiency trends, as well as policies that influence them across the state and throughout the pandemic and beyond. Now I'd like to walk through a few key policy changes that have influenced food access since the pandemic began. In our brief, we created an interactive bi-monthly timeline that shows food insufficiency trends for all New Yorkers, both overall and separated by households with and without children, mapped alongside some major policy shifts. The link to that timeline should be dropped in the chat. In response to the pandemic's economic fallout, several federal and state policies were introduced in 2020 and 2021 to expand food access. And these programs included emergency SNAP allotments and federal waivers for universal free school meals. As the pandemic restrictions eased and the public health emergency ended, many of these supports were phased out. Free school meals ended in 2022, and SNAP emergency allotments ended in 2023. For those who are interested in exploring the timeline and trends more closely, I encourage you to review the interactive timeline. It provides a broader view of how supports were scaled up in 2020 and 2021 and how they were largely phased out by 2023. So let's begin by looking at food insufficiency among all New York households. Since 2021, food insufficiency rates in New York have steadily climbed. Rates in 2024 are now higher than they were in 2020 at the onset of the pandemic. And now over 1 in 10 New Yorkers experience food insufficiency in the last year. This is the highest rate we've seen in the past 5 years. This translates to over 15,000 additional families or households affected compared to 2020. The noticeable drop you see in 2021 reflects the impact of these expanded investments in food access and household economic support. But as those safety net programs ended, we've seen food insufficiency rise again in 2022, 2023, and now even more so in 2024. Here, we see food insufficiency rates broken down by household type. On the left, you can see data for household with children, and on the right, we see data for households without children. Across all years, households with children have been more likely to experience food insufficiency than households without. In 2024, about 1 in 8 households with children reported not having enough to eat, and this was a slight decline from the peak experienced in 2020. However, for households without children, rates reached a 5-year high in 2024. This graph displays food insufficiency rates by race and ethnicity, and beginning from left to right, we see rates for white, Asian, Black, and Hispanic New Yorkers. So we continue to see persistent racial and ethnic disparities. Every year, Black and Hispanic New Yorkers reported higher rates of food insufficiency compared to white and Asian New Yorkers. And while there has been a slight decline in food insufficiency for Black and Hispanic New Yorkers since the early stages of the pandemic, they have increased amongst white and Asian New Yorkers, yet still these disparities remain significant between groups. Our final graph breaks down food insufficiency rates by household income across 4 income categories. Food insufficiency increased across all income levels in 2024 compared to 2020. And most strikingly, about 1 in 3 New Yorkers with household incomes below $25,000 reported experiencing food insufficiency last year. So taken together, the data shows that there's a clear trend. Food insufficiency in New York State is getting worse, and the increase closely tracks with the expiration of these critical safety net programs. And based on our findings, we've identified several policy actions New York can take. So given the persistent challenges for families with children, the state could implement universal access to healthy school meals and strengthen summer EBT programs to better support food access year-round. Also, the continued disparities by race, ethnicity, and income point to the need for stronger outreach, improved enrollment systems, and maximizing benefits in SNAP and WIC programs. It's also critical to ensure that emergency food programs receive consistent and adequate funding. You can explore all of these findings and recommendations in more detail in our full brief, linked in the chat. And next, we'll hear from Joel and Kim from Hunger Free America, who will help put these 2024 data points into context, especially given the many policy developments that have taken place over the past year. And thank you so much for your time, and I'm looking forward to hearing from the rest of our panelists.
Great. Thank you so much, Camille, for your review and overview of that data. So as you mentioned, now we'll transition to a Q&A with Joel and Kim. We have a few questions to get started and topics, and then we'll be kind of pulling your questions from the chat. So feel free to add those as we move forward. Joel and Kim, just kind of starting off, please briefly introduce yourself. Tell us about your journey in food access and advocacy and kind of your current role and what you're doing now.
Hi, I'm Joel. I'm the CEO of Hunger Free America. We are a nationwide advocacy and direct service organization. Thanks to the NYHealth Foundation, not only for generously funding us and so many other vital groups working on these issues, but also holding this really important seminar. It's really amazing. There are 263 participants, a much higher level than most webinars we're on. So thank you all for joining. I should say I previously worked for 8 years before 24 years ago, when I joined this organization for the U.S. Department of Agriculture, I worked for the Secretary of Agriculture. So I've been working on these issues a very long time. Kim?
Hi, everybody. I'm Kim Oscar-Rotolo. I'm currently the Director of Communications and Advocacy for Hunger Free America. A little bit about my history. I actually worked in journalism for many years. I worked for CNN and then later for Bloomberg Television. I actually shifted in 2021. I ran for City Council, which gave me a really unique opportunity to learn a lot about New York City's systems and how we help people and, you know, things that we could do to make people's lives better. So obviously I did not win, but when that campaign was over, I decided to shift gears and use my communication skills in the service of this really important work. And so that's when I began working for Hunger Free America, where I've been now for over 3 years. And so currently, you know, my role is both to communicate the importance of our mission and trying to connect people with food benefits at the federal and state level, and also to advocate for policies that we think will help people to be able to access ample and nutritious food. So I'm excited to be here, and I'm just want to thank Andrew and the New York Health Foundation for giving us this opportunity.
Thank you both so much. So yeah, kicking us off, Joel, you know, thinking about the food insufficiency data that we've seen from the past several years, what really stands out most to you, and how would you say it either reflects or doesn't reflect the kind of reality that you're seeing on the ground and in your work?
Well, thank you for that question, Andrew. So certainly your data is one key way of measuring this. There are 3 other sets of data. There's the USDA food insecurity data. There is the U.S. Census Household Pulse Survey data. And then there's what we see with our own eyes at soup kitchens and food pantries and when food banks have mass distributions. And I'll close with the last, when there are some people on the right who think we're making this all up. You know, I revert to the Chico Marx line. Who are you going to believe, you or your own eyes? That's often attributed to Groucho, but it was actually Chico for the record. And so we know the numbers your study found track very, very, very closely to the federal data that Hunger Free America has found. Now, I think it's important to distinguish food insecurity in the US context, in the New York State context, from what it might be in overseas. And understand that it is a bit different compared to, let's say, North Korea, or parts of Central America, or parts of South Asia, or parts of war-ridden, Yemen or Sudan, where people literally are starving to death, where people are literally going months without food. That's not quite the situation here for most families. It's people rationing between food and rent. It's people buying less healthy, ironically more fattening food, sometimes because, or less healthy food, because it's less expensive, it's more likely to exist in low-income neighborhoods, it's less time-consuming to prepare. It's parents skipping meals to make sure their kids are fed. And sometimes it's kids skipping meals entirely. One principal told me they saw one of their students going through a dumpster in back of the school. So my point is, even though we're not as bad as North Korea or Yemen, we should take no comfort that over 2 million people in the state live in households that can't afford enough food. We know the level of food insecurity we do have in New York hurts every other issue we care about. We've heard about the racial injustice issues. There's gender injustice issues. Households headed by single women are 3 times as likely to be food insecure as households headed overall. While long-term residents actually have lower food insecurity and poverty rates than new immigrants are particularly harmed. And we know that many seniors, many working people, and many legal immigrants who are eligible for safety net programs don't get it because of the stigma. And so this level of hunger we do have, even if the parents successfully shield the kid from lacking food, the psychological damage is immense. Every child in a food insecure household knows exactly what's going on. And so even if they eventually get fed, it dramatically hampers their educational performance. And if they don't get fed, it devastates their educational performance. I always say, to be schooled, you must be fueled. To be well-read, you must be well-fed. This also hampers the ability of adults to be economically productive. A Nobel Prize-winning economist found that in the Industrial Revolution, one of the top reasons that England advanced just wasn't more technology, but it was better nutrition for their workers. We know that food insufficiency is one of the top reasons older New Yorkers are forced to leave their homes and go to assisted living or nursing homes or hospitals or worse. And so this food insufficiency not only desperately harms our morality by forcing people out of their homes, also increases dramatically healthcare spending on Medicaid and Medicare. So unfortunately, and where I started, your findings are exactly in line with all the other findings. And it's important to note, this exists in every rural, suburban, an urban community in the United States, in New York and the United States. Someone asked about the county or borough information. Maybe later we can post in the chat our own study of USDA data that does break it down by every borough except Staten Island, which doesn't have a big enough sample. Brooklyn has the largest number of food insecure people in New York City, but the Bronx has the greatest percentage. And a shocking statistic: 1 in 5 children of the Bronx live in food insecure homes. Again, in the city, with probably, I think, over 100 billionaires now, we have just in the city 1.4 million people living in homes, 1.2 million people in homes that can't afford enough food.
And this actually, I think, speaks to the first question that kind of came through the chat, and we'll actually follow up on maybe the second part of that question in a minute. But so with this new federal administration, we've seen some pretty sudden and significant shifts in federal food policies, and I think we're expecting some more to come down the line. So just what are some recent policy changes that you've seen already that you feel are going to impact food access here in New York State?
Thanks for that, Andrew. So first of all, as Joel said, I did put in the chat, we have a hunger report that we put out back in November that breaks down some of that data, including, there was another question in the chat about how many people who suffer from food insecurity are employed, are working. There is data in those reports with that information as well, so I encourage you all to check it out. In terms of what's happening at the federal level, obviously there are some very disturbing things that we are seeing coming out of Washington and the Trump administration. Just last month, they announced that they were cutting over $1 billion from 2 really important programs, the local food purchase program and the local food for schools program. So these are programs in which the federal government essentially gives the states money to give money to local farmers so that they can provide food for food banks and food pantries, as well as to local schools. So this sudden cut in these programs not only hurts people who rely on these programs, it hurts children who eat food at school, and it hurts people who rely on food pantries and food banks, but it also hurts farmers. This program was meant to both help the economy of these states and help farmers in those states who might be struggling, and also at the same time help people who are food insecure. So we think obviously that is a very short-sighted change. There was an article recently that actually said that the New York Department of Agriculture in 2023 and 2024 distributed nearly $50 million to 114 organizations through the local food program funding that they had received in those years. So that's, $50 million that had been going to local farmers and then to organizations to, help them put that food out. That's, going to be something that's going to need to be made up. And as we're talking about the state budget process right now, obviously those are concerns that I think a lot of our state legislators have. Another thing that I want to talk about is the change to something called the community eligibility provision, which I think a lot of folks are familiar with, but I will refer to my notes just to make sure that I get it right. So it essentially allows the nation's highest poverty schools and districts to serve breakfast at lunch at no cost to all enrolled students, basically bypassing them having to fill out applications, because if enough of them have already qualified for another program such as SNAP or TANF, which is the temporary assistance for needy families. For a while, that number was set at 40%. The Biden administration actually lowered it to 25%, which means that as long as 25% of students in that district qualified for either SNAP or some other specific means tested program, that automatically all kids in those schools would get free school breakfast and lunch. There is now a proposal to raise that to 60%. Obviously, that would significantly cut a number of students in a number of school districts and schools out of that program. There was a recent article that estimated that about 908,000 students in New York could lose access to free meals under this proposed eligibility change. So obviously that could have potentially a really huge impact. And then the final thing I will say, obviously, we are very concerned about potential potential cuts to the SNAP program. We've been pushing for many years to increase SNAP allotments. We were hoping that the allotments that were put out during the pandemic could be made permanent, but they were brought back to their original levels, which already isn't enough. And so we've been advocating very strongly for folks to call their representatives to really advocate for there to be no cuts to these really important federal programs. So, there's a lot going on and there are a lot of moving pieces. Things are changing. We just had a budget vote a couple of hours ago. So it's kind of difficult to keep up with everything. But I think from our perspective, the cuts to federal food programs, changes to the community eligibility provision, as well as cuts to some really important programs that help both food insecure people and farmers. I think those are the changes at the federal level that we're most concerned about.
And can I just add two things on that, Kim? Number one is about the community eligibility. Many of you know, and many of you have been working for a long time, as we have, to try to get universal school meals in New York. I know the New York Health Foundation, funded efforts to advance that. And it was a huge win that we collectively got Governor Hochul to announce she's for it. The Speaker of the State Assembly's for it. I believe the Senate Majority Leader's for it. So I think it's going to get done should we ever finally get a state budget. But understand that state funding, making universal meals a reality, is contingent upon the existing community eligibility provisions standing in New York. If those went away and were really raised to 60%, it would dramatically increase the cost for the state to do universal school meals. And two, some of you work for charities, well, maybe charities can pick up the slack. Understand that as underutilized as SNAP and WIC are and school breakfast are, many people eligible for those programs don't get it. The dollar amount of food provided by those programs equals 17 times the dollar amount of food provided by every charity in New York, every soup kitchen, food pantry, food bank, food rescue group, food shelf, brown bag program, etc. We're talking the state could lose billions of dollars of federally funded food per year. And so if you think, well, my charity or faith-based group will just raise more money or get more food donations to do this, understand even the best run of your agencies would only be able to do a drop in the budget.
Very good context. And I touched on our next question, and apologies, I think my bandwidth is getting a little choppy for folks, but hopefully I'll copy the questions in the chat and we can get through. So in addition to the policy changes that we've seen, you've sort of already elevated some potential things that we're real concerned about. I just want to flag, are there any other additional challenges, or may I suggest opportunities that you might even see given to move certain pieces of food policy forward, given the Make America Healthy Again movement or other priorities?
The challenge is keeping them to be consistent with what they say they want to do. And so Robert F. Kennedy Jr., the HHS secretary, says over and over again that unhealthy food is a great detriment to the health of the nation. And he's 1,000% right. Diet-related diseases are one of the top causes, along with gun deaths and along with auto accidents, one of the top causes of early deaths in America. And they want to take some of the wrong steps that we think are some of the wrong steps, restricting what people can buy with SNAP, even though there's no evidence whatsoever. People on SNAP shop less healthily than anyone else, and SNAP equals only 4% of the food purchased in America every year. But they are taking some steps supporting West Virginia, restricting some, dyes that may be carcinogenic in some foods, talking about other improvements to nutrition guidelines. And so it won't shock most of you to know that I don't particularly view this administration as an ally on much, if anything. But there's a truism in politics: there are no permanent allies and no permanent enemies. And so, if there are ways for us to keep them consistent and actually support a true plan of healthier food for America, we are in. Again, they haven't been consistent. Cutting off food purchases from farmers of produce to go to food banks and schools seems the opposite of making America healthy again. So that's on the national level. And then I think the state level, there are real opportunities for elected officials, these cuts, to raise red flags about the importance of these programs and to give us more leverage to push the state, in counties and businesses and philanthropies to not only push back against some of these federal cuts, but try to fill in the gaps themselves. So I think our top tool is using their own rhetoric to hold them accountable, that if you're really serious about making people healthy again, you don't start by making them hungry again.
That's right. Thank you so much. On the next one, I'm going to try to disconnect and use my phone. Hopefully that will help with my audio. I'm so sorry. So, Kim, New York State nearly tripled state investments in food security programs between 2019 and FY 2025. Over 250 million more to expand school meals, support summer EBT, address food insecurity, while creating economic opportunities for farmers through Nourish New York. It's still quite small relative to the funding that comes into our state and federal food programs. Nearly $9 billion alone for SNAP, WIC, and school meals. And the challenge of food access and affordability continue to persist. So what are some specific steps that state and local governments here in New York can do to improve food access in the current federal landscape, or what programs or policies that exist are currently being discussed do you feel that would have the biggest impact on hunger in the state?
Yeah, thank you for that question, Andrew. So, yes, I mean, you are correct. Ultimately, what the state can do pales in comparison to the resources that we have been and should be getting from the federal government. As Joel said in his previous answer, yes, we are on the cusp of having this really great universal school meals program for our state, but of course, yes, it is contingent upon keeping the same eligibility rates for the community eligibility provisions. So, there are still a lot of unknowns currently. A few of the things that we focus on in terms of what the state can do to improve the lives of those who are food insecure. First and foremost, despite potential cuts to the federal programs, they are connecting people to those federal programs is still by far the most effective and the most cost-efficient way for the state to tackle food insecurity. And so, anything that the state and cities can do to help connect people better to those resources is incredibly important. Obviously, we support full funding for state programs. There is the NOET program that stands for Nutrition Education Outreach Program, and that program is specifically for funding for those outreach efforts. So, having navigators who work with people to make sure that they are connected to the benefits that they are eligible for. We've also been a really big proponent of streamlining the process. It doesn't make sense to us that people should have to go through the same process multiple times to apply for different benefits, whether it's SNAP or WIC, any kind of cash assistance program. Something like 90 to 95% of the information required for eligibility in these programs is the same across all of these programs. And so, we have really been pushing both state and city government to streamline those processes. In New York, in New York City, we've been pushing really hard for something called a My City platform that would allow people to apply for multiple benefits at one time. So we think that could be incredibly helpful. Some other pieces of legislation that we are really focused on at the state level currently, there is the increasing the SNAP minimum. So there are some folks who are eligible for SNAP, but maybe get as little as, say, $23 a month. So this is a bill that would essentially establish a state SNAP minimum benefit program. Now, our understanding is actually Governor Hochul in the proposed budget proposed a sort of a version of this that wasn't quite at $100. I believe she put it at $50. But there is a bill that is sponsored by Senator Rachel May and Assembly Member Jessica Gonzalez Rojas that would make the minimum benefit for SNAP here in New York $100. And so that means if you're eligible, but you're only receiving, say, $30 of SNAP benefits, then the state would fill that gap to make sure that nobody on SNAP is receiving less than $100. We've also been really concerned about EBT theft. That is something that happens really frequently. It's mostly card skimming. And unfortunately, the federal program that had been reimbursing people for that theft was shut down. So we are big proponents of improving the EBT card security, making them chip cards, which are much more difficult to skim. So we, strongly support that. And then more broadly speaking, there are other policies that we can do at the state level that maybe aren't directly related to food insecurity, but that we think will greatly impact people's ability to afford food. So we support, for example, ending the sub-minimum wage for tipped workers. And we also support a state HOPE Act. So the HOPE Act is a really interesting program. It would essentially create a pilot program that would allow the government to pilot programs that would help people with perhaps getting a loan to start a business or to buy a first home, allowing people to generate assets, which we think is one of the most important things that people can do in terms of, moving themselves into the middle class and staying in the middle class. So, from our perspective, there are some direct things that we can do to help people access the federal benefits that they need. We really hope that the state government will focus on putting resources there. But broadly, none of these issues exist in a vacuum, right? So, people are facing food insecurity. Part of that may have to do with their housing prices being too high, or, having issues with childcare and perhaps not being able to work full time because they can't afford childcare. So we're also big proponents of attacking the root causes of poverty, because we think that if we attack those, then it will provide people with more money that they can then use to feed their families.
I should also add, we strongly support ensuring adequate funding for Nourish New York,
Yes.
and HIPNAP. And it's a false choice to say either you support the charitable food endeavors or you support a strong safety net. There are some people who make too much money but are still struggling to access SNAP. There's some people who don't get it because of their immigration status. So a state as great as New York can chew gum and walk at the same time, and so can support these charitable food endeavors and also support stronger access to a guaranteed safety net.
You are muted, Andrew.
I'm sorry, I'm trying to use my phone here. Can y'all hear me a little bit better?
Yes.
Okay, I'm gonna give this a shot. Thank you so much. We've got questions rolling in the chat, which I will work to get there. One last question, I think, before we kind of move on to open questions is just, and thank you for naming all those various, SNAP for all, SNAP minimum benefit, processing times, support for, navigators, doing more on the state to bring more people into these benefit programs. I think those are obviously really important things we can do on state and local level to move things forward. But Joel, one aspect of your work that I just wanted to highlight is you all work really hard to elevate community voice in your advocacy. So, bringing people experiencing hunger to the table with elected officials and really, other decision makers. So just please share, why you all feel that's so important and what ways you're doing that work.
As the great New York State resident, Rochester resident, Frederick Douglass said, "There's no progress without struggle. Power never concedes itself willingly. It never has and never will." No social movement in history has been won by one people on behalf of another. If it was still up to men, the women on this call wouldn't be legally allowed to vote. If it was just up to white people, we wouldn't have had even the imperfect progress we've had on race in this country. over and over again. If it was just up to straight people, we wouldn't have marriage equity, in this country without the people most affected fighting for it. So this idea that what we really need to do is raise wages and have employers pay people more and have adequate taxes on the wealthy to fund a safety net, and that people with employees will automatically on their own decide to pay their workers more, or people who are billionaires will automatically on their own decide, to raise their own taxes, is preposterous. So we need a political movement by the people most affected by these issues to be in the lead. Hunger Free America is imperfect in what we're doing on our own, but we do have a food action board of people with lived experience. We're empowering to be leaders in this movement. We compensate people whenever we can to attend meetings. We're pushing for every entity in the state that's fighting hunger, not just to drag low-income people out occasionally to speak at a fundraiser and say, oh, woe is me, I'm so happy this organization fed me, that's all fine, but to really empower low-income people to speak out for the policy changes they need, to testify on their own behalf, to speak to the media, to lobby elected officials. And I really can't too fervently urge all of you to better organize the recipients of this. Now, not everyone's going to want to speak out. Some people worry about their immigration status. Some people may be struggling with mental illness or substance abuse issues. So obviously, all this has to be voluntary, but there are plenty of the over 2 million food insecure people in New York who would welcome the chance to speak out on their own behalf and not be dependent on all of us to be their voice.
Great. Thank you so much, Joel. So as I'm looking through the chat, I see a few things I'll maybe try to address quickly and then kind of move into broader questions for you all. But I would say, it looks like Philip Giles, seniors and older adults, Julie McCarthy, who's a fellow program officer, addressed this, but in the chat, but seniors and older adults with limited incomes experiencing food insufficiency are often overlooked. And what info do we have on how older adults are faring with reductions in safety net programs and funding? I think we think about this a lot with rural communities in particular because of transportation challenges and issues and congregate meals and home delivery. But we are, as Julie elevated in the chat, we're actually working on this data right now, our policy and research team. So we're hoping in the next couple of months we'll have some data, and we're also doing a sort of survey and focus groups with older adults, and we'll hopefully have toward the end of the year or in the fall some more data that we can have the information we need to sort of drive the conversation forward and inform the policy that will have the greatest impact. But just wanted to elevate that. Kim, I don't know, Joel, if you have other perspective you'd like to share specifically around older adults in the state.
Yeah, and we do have data on that for New York. I don't have the tip of my tongue. If Kim has a chance, maybe she can find it. We can send along later. So there's good news and bad news about this. The good news is that food insecurity data generally shows that food insecurity among seniors is less severe than among children. And I think the prime reason for that is Social Security Act. Before the Social Security Act and the New Deal, older Americans tended to be the poorest people in America. And now they are less poor than families with children. So that's the good news. And don't get me wrong, the level of food insecurity we have among seniors is appallingly high. But also the bad news is the food insecurity measure, the USDA food insecurity measure only measures economic access to food. And so if older adults have limited physical ability to go out and get food or prepare food from themselves, that's not necessarily measured by the food insecurity index if they don't happen to be poor. And so my late mother in Rockland County, she had trouble accessing food in her later years when I wasn't able to be there physically. And so I think our measures really undercut that. And I will say HHS has been last few weeks eviscerating the staff to manage the senior programs. The Meals on Wheels program, which a lot of people don't know, receives a lot of federal funding. Senior Center Meals, which a lot of people don't know, that's federal funding. So again, them taking away food is going to make a tough situation, much worse.
And I did just put the data in the chat there, Andrew, for older New Yorkers, but also children and employed adults for anyone who wants that info.
And so again, it's half as much as children. But if you didn't know children, if you said, oh my God, in this incredibly wealthy state, nearly 1 in 10 seniors don't have enough food. And this is just the economic ability to get food. You would be appalled, and we should be appalled. So again, I want to stress, just because I said it's not quite as bad as for children, I'm not saying it's anything close to vaguely acceptable.
Great. Yeah, thank you
With
so
each
much for
passing
that
year, I
additional.
feel even more strongly about that.
Sorry, what was that?
And with each passing year, I feel even more strongly
Yes, absolutely.
about that.
Right. Absolutely. Thank you so much. I think another question we have here really is about the 1115 waiver with Medicaid, and I think food support and food interventions for food insecure individuals. That's just now kind of been rolling out with the social care networks, and that's a 3-year waiver. We'll see what happens to Medicaid, obviously, with all the changes at the federal level, but just wondering if you all have some perspective from, what you're seeing with social care networks and the food providers, and how that's starting to play out across the state.
Well, I could take that. There are two elements of the Medicaid waivers, and we're talking potentially billions of dollars that impact our field. One is directly being able to pay for home tailored, medically tailored meals for people who are ill to either pick up or get delivered to them. And Hunger Free America isn't directly involved in that, but this whole area of food as medicine, which I know the New York State Health Foundation is funded and very interested in, is key. So that's happening. The second part of this is to pay for organizations to be navigators to help people access benefits. And Hunger Free America is working with Public Health Solutions to be able to do that in Queens, Brooklyn, and Manhattan. We've been talking to a different social care network in Staten Island about that. We've been talking about Somos about doing that in the Bronx. So this is a very large pot of money. There's still issues about the reimbursement rates and what's going to be reimbursed or not. And will the Trump administration sort of jerk around the states on payment for this? But this does open a very big set of opportunities. And the bank robber, Willie Sutton, was the one who asked why he robbed banks. And he said, that's where the money is. And the only place in the social safety net that really has, more money than SNAP is Medicaid. And so the fact that there is, at least theoretically, potentially very large sums of money set aside in Medicaid to improve public health through food is a very promising opportunity.
Great. Thank you so much. And yes, I know there have been some sort of successful starts to food as medicine with some of the social care networks in Rochester and New York City and the Bronx and other places. So, hopefully that will continue to grow and expand and provide food to folks who need it, leveraging those healthcare networks. And I guess one question, and please feel free to keep adding questions to the chat that kind of hasn't come up as much explicitly yet, is really high priority groups that, like New Yorkers, that aren't necessarily eligible for some of the safety net benefits. I know, Kim, you touched on this a little bit with folks who are sort of on the verge. I think it was you, it might have been Joel, talking about, people who are really close, who are working poor. That's the majority of folks who really need this benefits and this additional benefit. But sort of, what ways are we ensuring food access for the groups for programs that they are eligible? For example, WIC is available to anyone regardless of status. So just wonder if Kim or Joel, if you'd like, wants to take on that question.
Yeah, I mean, in terms of making sure that people who are eligible receive the benefits, this is one of the issues we struggle with. Because, at the end of the day, folks who are eligible for these programs should be able to utilize them. Part of the issue is just, as sort of we discussed before, the sort of onerous process of having to, apply for all of these benefits. Particularly with how slowly, unfortunately, both state and many cities have been at making sure that these applications are processed. Joel will definitely correct me on the facts here, but I believe that the federal requirement is that SNAP applications must be processed within 30 days. But as we have seen in the past, in this state in particular, that has not always been the case. And there are a number of reasons for that. But as Joel likes to point out, that was a requirement that was in place for years before we even had the internet, when people were faxing information to into the federal government. And so the notion that in this day and age, when we have so much technology at our fingertips, that we are still not meeting this very basic 30-day deadline is a real problem. So obviously, we are always really aggressive in advocating for local and state governments to really take the lead on increasing those processing times, whether that's, has to do with more staff or streamlining the process. Obviously there are a lot of requirements for these programs, but we just feel really strongly that there's no reason we can't get people processed more quickly, and that we can't make the process easier for people. I was testifying in front of the city council last week, and we talk a lot about opportunity costs and the notion that, for higher income people, if you are, have to spend time doing one thing, that's, time that you can't spend doing, something else that's really valuable. But we don't tend to apply that concept to low income people. So when we force them to spend many hours on the phone waiting to talk to, a benefits coordinator, when they have to take a day off work to go in person to a benefits office to bring in all of their information, they have to spend money on childcare because, they don't have anybody to watch their kids while they go through this process. All of that is time and money that they could be spending either, earning more money or spending time with their families or in their communities. So I think it's really important that we acknowledge that everyone's time is valuable, and particularly folks who are lower income, are already struggling to work and make money and to take care of their kids. And so, we are just always really strongly advocating to make the process as painless as possible, because the folks who are utilizing these benefits are the ones who often have the least resources available to them to be able to spend the time and the resources to make this happen.
Right. I agree, Kim, of course. And it's also key that the state fully fund the NOAP program through Hunger Solutions New York to help groups like ours and dozens of others across the New York State to help people through this process, but also dispel a lot of stereotypes. A lot of eligible people falsely believe they're not eligible. Some older New Yorkers think if they own a home, that counts as an asset against SNAP. It doesn't. Many working people think SNAP's only welfare that's not available to working people. That's not true. It's the poverty line plus 30%. For WIC, it's the poverty line plus 85%. So pregnant women or children under 5 in households can make, I think, into the 30s thousands a year, maybe even a little more, and still be eligible for WIC. For now, the 14th Amendment is still in place. And so anyone born in the United States is a citizen of the United States. So children in mixed status immigrant households can be eligible for SNAP even if their families aren't. And the other thing is that if food pantries and soup kitchens could work with us to do even more to help their clients who are eligible get those benefits, then they would have more food left over for the people who aren't eligible. And someone asked, what can food pantries and soup kitchens do right now to prepare for the cuts? I'd say the top thing is advocate, advocate, advocate. I mean, the budget only passed a preliminary round today by 2 votes in the House of Representatives. There are, how many Republican Congress people are there from New York, Kim? At least 5 or 6. I think yes. If only 2 of them switch their votes, then these cuts would be dead in their tracks. Many of you happen to live in districts representing them. It doesn't mean you shouldn't keep the pressure on the Democrats, but we're not partisan. The New York State Health Foundation isn't partisan, but it's just a factual matter. Every Senate Democrat and every House Democrat voted against the budget resolution bill, reconciliation bill, and every Republican in the Senate voted for it, but 1 or 2, and every Republican in the House voted for 1 or 2. So if you happen to be in a district, Congressman Lawler, Congressman, Stefanik, she's no longer resigning. I urge you to, as they say in the infomercials, don't wait. Go to your phones right now and contact them and say, we are a charity that's serving people and we can't keep up if you slash these programs. We can win this fight.
Can I, I'm sorry, Andrew, I know we're short on time, but can I just add one more point, which was something I meant to mention in my initial answer, which was another thing that we are really big on supporting is the notion of agencies having the ability to screen people for other benefits, particularly enabling, for example, departments of labor as they are, going through the process of getting people signed up for unemployment to be able to screen them to see, oh, wait, actually, you might also be eligible for SNAP and some of these other cash assistance programs. So, that sort of goes along with what we were saying with the streamlining process, but I think it's really important to understand, as Joel said, a lot of people don't know that they're eligible. We think that by empowering agencies to be able to screen people sort of across the spectrum of benefits that might be available to them, we will end up being able to educate a lot of people who otherwise might not have even thought like, oh, hey, maybe I'm eligible for SNAP. Obviously there are challenges in terms of implementing this, but we think that that is one way that we could, really help in terms of making sure that people know that they're eligible for these programs.
Great. Thank you all so much. You've touched on so many important things. How do I elevate the time? I think assumptions about, folks on benefits, like they have all the time in the world. I've definitely, in my background in urban agriculture, people are like, let them grow their own food, as if that doesn't take time, energy, and you don't need food year round. So I think really elevating and honoring the time of working families who are, really reliant on these extra dollars to help make ends meet is really, really important. No, thank you, Joel, also for elevating some of the questions about emergency food programs and the power that a voice can have with these tight margins of representation. So really making sure that we're speaking out, because ultimately emergency food is a Band-Aid, and there are policies that can, have a real impact long term. So that's really important. And then, yes, I think outreach, eligibility, we do have grantees working on, for example, a WIC outreach to New Yorkers, or so they know they're eligible, or with Schuyler Center, Community Healthcare Association of New York State, or Center on Budget and Policy Priorities are working on a project promoting sort of Medicaid and WIC policies that are designed to increase WIC participation by seeing that sort of automatic eligibility, right? And I know the state has, hopefully been working and might move more on the integrated eligibility across programs. I mean, that would be so important to make these sort of programs available with one application process or with one conversation, as opposed to having so many different, applications, questions, conversations, sometimes in person, right, that create barriers for folks. It looks like we have another comment also, automatically enrolling people based on their federal income tax filing. So if you see in their income taxes that they're eligible for something, just automatically having them enrolled seems would make it probably really easy, hopefully, for folks. You would think the federal government would have all they need through income taxes to do most of that. Thank you. It looks like Ryan from Feeding New York State has shared some resources around Joel's conversation on advocacy. So thank you for sharing those resources and the work that folks are doing to impact state policy. 211 as well. Thank you for sharing those resources. I guess maybe one more quick question before we start wrapping this up. Just thinking about Summer EBT, it's one of the programs that has not been named as something that will be eliminated right now. Last year was our very first year as New York providing that benefit to students and their families. So, from what you've seen last year, from what we've learned, looking toward this summer, assuming it's going to continue, what would you say are some critical steps the city or state or nonprofit partners could be doing to sort of help ensure effective promotion and implementation of that work?
I mean, I will say currently we did this last year as well, a number of anti-hunger groups and advocacy groups have been working actually with the Albertsons Company to really promote Summer EBT, promoting it both in-store, but also creating a marketing campaign across the country to both on social media and reaching out to sort of traditional media outlets just to let people know that it exists. One of the unfortunate things about the way that it was rolled out was folks who were already enrolled in SNAP, it wasn't, they were basically given new cards for these Summer EBT cards. And so part of it was making sure that they knew that this new thing was going to be coming in the mail, which is often complicated because we all get so much junk mail and credit card offers. And, also there always isn't a lot of trust. People think they're being scammed. And so I think just having reliable and credible people in the community and sort of credible news sources for folks to get that information, to know that the program is happening, to understand who is eligible for it. I think that's the key. You know, we've suggested from a policy perspective to our state and local governments to create their own websites that talk about the eligibility, that promote the campaign. You know, we often see sort of big city and you know, ad campaigns here in New York City. We have the subway where folks are, you know, putting ad campaigns up, but really letting people know that this is a program that is available to folks who have school-age children, and that they just need to, if they are not already enrolled in a program like SNAP, that they need to apply for it, but that it is there for them and can help them sort of really make ends meet during the summer when traditionally child hunger is at its highest. So I think just informing people and making sure, and then I would say the other part of it is for folks who are in states that did not opt into the program, because not every state opted in, making sure that folks in that state, even though they can't access the program, making sure that they're reaching out to their local legislators, their governors, and imploring them to opt into the program when they have the opportunity next, because it, you know, this really helps people. So yeah, I think informing people and then advocating for the program in states that aren't currently opted in are probably the best things that we can do to ensure, you know, the future of the program.
Great. Thank you so much, Kim. And I'm sorry, I know we had a couple other questions come into the chat, but we have to start wrapping up here. So again, thank you, Camille, Joel, Kim, for taking your time to speak with us. Thank you so much, everyone in the audience, for joining.